for choosing Erlanger Gastroenterology for your healthcare needs. My name is Jasmine Hawkins. I am a medical assistant at Erlanger Gastroenterology. Today we are going to walk you through how to prepare for a colonoscopy, what it is, why we do it, and why getting a really good clean out is absolutely essential for an accurate exam. A colonoscopy is a procedure where your doctor uses a thin, flexible camera to look inside your colon and rectum. This allows them to check for things like inflammation, bleeding, polyps, or early signs of colon cancer. The great news is that colonoscopy is one of the most effective tools we have to prevent colon cancer because doctors can remove polyps before they even become something dangerous. Now let's talk about the part nobody exactly loves, the bowel prep. I know it's not the most fun process, but it is truly one of the most important steps. Here's why. A colonoscopy camera is only about a width of a finger. Even small amounts of stool can block the view or hide polyps or lesions. If the colon isn't clean, the doctor might miss something important, or you might need to repeat the whole procedure sooner than expected. A clean colon means more accurate results, a safer procedure, a shorter exam, and in many cases, a longer time before your next colonoscopy. About 1 week before your procedure, you should begin transitioning to lower fiber foods. This helps reduce the amount of residue in your colon and makes the final clean out much easier. The pre-anesthesia team, also called the PAT team, will contact you before your procedure. They'll review your medication list and give you clear instructions on which medications to stop, which to continue, and exactly when to hold them. Please also remind your ride about your procedure and arrival time. For 3 days before your procedure, avoid foods that are high in fiber or that leave seeds or skins behind. This includes fruits, nuts, red meats, seeded jellies, corn, seeds of any kind, vegetables, especially raw or fibrous ones, whole grains, or brown breads. On the day before your colonoscopy, you'll switch to a full clear liquid diet. That means no solid foods at all. Everything you consume should be see-through or nearly see-through. Clear liquids you can have include water, broth, apple juice, juice without pulp, sports drinks that are not red or purple, popsicles, clear sodas, teas or coffee without milk or creamer, gelatin like Jell-O, and please avoid all dairy products. High sodium foods such as broths can help curb hunger throughout the day.
Welcome. Today we'll be talking about your Clenpiq bowel prep. My name is Dr. Andrew Mims and I'm a gastroenterologist. If your doctor has prescribed Clenpiq, you will need to have this filled at the pharmacy. You will also need to purchase 125 milligram simethicone extra strength or Gas-X tablets, as well as 5 milligrams Dulcolax tablets from the pharmacy. A prescription is not needed for these. Your Clenpiq prescription includes 2 separate 5.8 ounce bottles of bowel prep. You will need to take both of these before your colonoscopy. We will be using the split prep method, meaning half of your bowel prep will be taken the day before your colonoscopy, and the other half will be taken on the day of your colonoscopy. Your bowel prep begins the day before your procedure. At 4 p.m., you will start by taking 2 5 milligram Dulcolax tablets. Around 6 p.m., your bowel prep continues. First, you take 2 simethicone extra strength tablets. You will then drink the entire 5.8 ounce bottle of Clenpiq. Then, over the next 5 hours, you will drink a total of 40 ounces of clear liquids. You can use the cup provided in your Clenpiq's box to drink 5 8-ounce cups of clear liquids. You can continue having clear liquids until midnight. After midnight, you should have no solids or liquids other than the remaining dose of Clenpiq. At 4 a.m., take 2 more simethicone extra strength tablets. Then, you drink your second bottle of Clenpiq. Then, drink at least 4 8-ounce cups of clear liquids. You should stop drinking clear liquids 2 hours before your colonoscopy. We know this is a challenging process, but this is very important for your gut health.
My name is Andy Starling. I'm a registered nurse in the GI lab at Erlanger. Now that you've completed your bowel prep, let's talk about what should happen next. What is optimal stool output during prep? As you drink your bowel prep, your stool should gradually change in stages. Here's what to expect. Stage 1. At first you may pass normal or semi-solid stool. That's completely normal. Stage 2. As the prep starts working, your stool becomes softer and more liquid. Stage 3. Near the end, you should be passing clear or yellow liquid, almost like lemonade, tea, or light-colored urine. That final appearance, watery, yellow, and without solid pieces, means your colon is clean and ready for a safe, accurate colonoscopy. If it looks like lemonade, you've done it right. Let's go over some common issues people run into during their prep and how to fix them. What if I can't finish the prep because I feel too full, feel nauseous, or start vomiting? This is more common than you might think. Here's what you can do. Slow down your drinking pace. Take small sips instead of big gulps. Pause for 20 to 30 minutes. Take deep, slow breaths. Rinse your mouth with cold water, lemon, lime, or a mint between sips to help with the taste. Walk around a bit. Movement can settle your stomach. And drink the prep chilled rather than room temperature. What if I'm still passing solid stool after drinking most of the prep? If you're still seeing solid pieces or brown stool after most of the prep, keep drinking clear liquids. Hydration helps the prep work better. Make sure you take the full amount of the prep. If the second dose is scheduled for the morning, do not skip it. It's essential for cleaning the right side of the colon. What if I miss a dose or drink the prep too late? Timing is very important. If you accidentally miss your evening dose or take it later than scheduled, take the dose as soon as you remember, unless it's so late that it interferes with the morning dose. If you miss the morning dose, call your clinic right away. Missing the second dose may mean your colon is not clean enough for the procedure. When to call your care team. Reach out to the clinic at 423-778-4830 if you cannot keep the bowel prep down. You have severe abdominal pain, not just cramping. You are still passing brown or solid stool after finishing the prep. You're unsure about timing or missed doses. You feel lightheaded or dehydrated. You are vomiting and can't tolerate the prep. A copy of your prep instructions has also been sent to your MyChart for your reference. Remember, the goal of the prep is to get your stool to look like clear or pale yellow liquid. That's the sign that your colon is clean and will be able to get the most accurate results. Prep can be uncomfortable, but you are doing something incredibly important for your health, and we're here to help you through every step. If you have any questions or run into problems, don't hesitate to call our office.